NHA Medical Assistant Exam 2026. Question 1. Which test is used to determine the best antibiotic to treat a condition? Blood agar, culturing, morphology, sensitivity. Sensitivity testing, antibiogram, determines which antibiotics are effective against a specific bacterial isolate. Discs impregnated with antibiotics are placed on inoculated agar. A clear zone indicates sensitivity. This guides appropriate antibiotic selection, reducing resistance and improving outcomes. Culture identifies the organism, and sensitivity determines treatment. Question 2. A blind weight is done on a patient by not recording the weight in the chart, asking the patient to self-weigh at home, weighing the patient in a wheelchair and subtracting chair weight, shielding the readout so the patient cannot see the reading. A blind weight prevents the patient from seeing the scale reading, often used for patients with eating disorders or those anxious about weight gain, e.g., pregnancy. The weight is still recorded in the chart. This technique reduces anxiety and promotes compliance with treatment. Question 3. An effective way to handle patient emergencies in a medical practice office is to take which step in advance? Ask very sick patients to go to the ER. Identify at-risk situations likely to occur and prepare to provide care. Make sure a doctor is always available. Have a first aid kit in the office. Proactive emergency preparedness involves identifying potential emergencies based on patient population and preparing protocols, supplies, and training accordingly. General measures like first aid kits and poison control numbers are helpful but not targeted. Knowing likely emergencies improves response effectiveness and patient outcomes. Question 4. In the event of a large-scale bioterrorism attack, which step would not be used by a medical office practice? Coordinate with local public health officials. Provide vaccines or immunizations. Know signs and symptoms of disease outbreak. Send patients to the ER for diagnosis. Medical offices should be able to diagnose and manage patients during a bioterrorism event, not send all patients to already overwhelmed ERs. Offices should coordinate with public health, provide vaccines when available, recognize disease symptoms, and maintain infection control. Office-based triage preserves hospital resources for critically ill patients. Question 5. Snellen testing results give information about blood sugar results, visual acuity, ability to hear vibratory sound, blood pressure. The Snellen chart measures distance visual acuity. Results are recorded as a fraction, e.g., 20/20ths, 20/40ths. 20/20ths is normal. 20/40ths indicates the patient sees at 20 feet what normal vision sees at 40 feet. The Snellen test does not assess color vision, Ishihara, hearing, audiometry, or blood pressure. Question 6. Which emergency situation should receive the first priority? Bleeding from a forearm laceration, airway obstruction, open fracture of the femur, midsternal chest pain. Airway obstruction is immediately life-threatening and takes priority. Without a patent airway, brain damage occurs within minutes. The ABCs, airway, breathing, circulation, guide emergency response. Chest pain, bleeding, fractures, and seizures are serious but secondary to establishing an airway. Always check airway first in any emergency. Question 7. The medical assistant's role in obtaining informed consent is explaining benefits and risks of the procedure, making sure the patient understands and has no questions, answering all questions the patient has about the procedure, witnessing the signature of the patient. The MA witnesses the patient's signature, confirming that the patient signed voluntarily and appeared to understand. The provider is responsible for explaining the procedure, risks, benefits, and alternatives, and answering questions. The MA should not assume the provider's role in obtaining consent. Witnessing the signature is a legal requirement. Question 8. To remove sutures, the medical assistant should have a tray with Kelly hemostat, Mayo scissors, Sen retractor, Lister scissors. Lister, suture, scissors have a small hook on one blade to slide under sutures for easy removal. Kelly hemostats clamp vessels, Mayo scissors cut heavy tissue, Sen retractors hold tissue open, and bandage scissors remove dressings. Using the correct instrument prevents patient discomfort and tissue damage. Sutures should be removed only with provider approval. Question 9. When there is an unidentified clear liquid on the exam room floor after a patient leaves, the MA should ask the patient what the liquid is. Clean up with a paper towel and place in regular trash. Put up a wet floor sign and ask housekeeper to clean. Put on exam gloves, clean up with a paper towel, and place in biohazard container. Unknown body fluids should be treated as potentially infectious. Standard precautions require gloves, not necessarily sterile, and disposal of contaminated materials and biohazard waste. Do not ask the patient embarrassing questions. Housekeeping may not be trained for biohazard cleanup. Sterile gloves are not needed for cleaning spills. Question 10. A viral infection cannot be transmitted by droplets. Will always resolve in 7 to 10 days. Does not respond to antibiotic treatment. Causes tuberculosis. Antibiotics are ineffective against viral infections because they target bacterial cell walls or protein synthesis. Some viral infections are self-limiting, but others, e.g., HIV, hepatitis, are chronic. Some viruses spread via droplets, influenza, COVID-19. Tuberculosis is bacterial, not viral. Vaccination prevents some but not all viral infections. Question 11. Factors that affect drug action include all except body weight, use of generic medication, sex, age. Generic and brand name medications contain the same active ingredients and have the same effects. Body weight affects distribution, sex influences metabolism, age affects absorption and excretion, and disease processes, especially liver/kidney, alter drug clearance. Understanding factors influencing drug action is essential for safe medication administration and patient education. Question 12. When checking supplies, the MA notices hemostats autoclaved 28 days ago. The MA should confirm each package is intact and undamaged. Count to see if enough are available. Place packages back in the autoclave to re-sterilize. Unwrap, repackage, and run through the autoclave cycle. Sterile packs have a defined shelf life, typically 28 days. After expiration, they must be reprocessed. Unwrap and repackage before re-sterilizing. Simply re-sterilizing without repackaging may not ensure sterility. Using expired packs risks infection. Confirm facility policy for sterile pack expiration dates. Question 13. Symptoms of insulin shock, hypoglycemia, include fruity breath and decreased blood sugar, tremulousness and elevated blood sugar, diaphoresis and fruity breath with increased blood sugar, diaphoresis, tremulousness, confusion, and decreased blood sugar. Insulin shock, hypoglycemia, symptoms include diaphoresis, sweating, tremulousness, shaking, confusion, weakness, and hunger. Fruity breath indicates diabetic ketoacidosis, hyperglycemia. Immediate treatment with fast-acting carbohydrates, glucose tablets, juice, is essential. Severe hypoglycemia can lead to unconsciousness and seizures. Question 14. Which step helps ensure smooth operation during a patient emergency? Adhering to a pre-established plan and protocols. Avoiding appointments for seriously ill patients. Arranging for close proximity to the local ER. Clearing the office out during an emergency. Pre-established emergency plans and protocols ensure that all staff know their roles and can respond quickly and effectively. Having an AED is important but is part of the plan, not the overarching factor. Clearing the office is unnecessary and may cause panic. Proactive planning improves patient outcomes during emergencies. Question 15. Prior to administration of a local anesthetic, the medical assistant should administer a test dose to check for allergy. Ask what local anesthetic was used in the past and use the same. Carefully take an allergy history. Confirm the patient has someone to drive them home. Taking an allergy history is essential before administering any medication. While true allergies to local anesthetics are rare, patients may be allergic to preservatives, e.g., methylparaben or epinephrine. Test doses are not standard practice. Previous reactions should guide medication choice. Document allergies and verify before each procedure. Question 16. The knee chest position is used for proctological exams, vaginal exams, exam of chest and upper torso, patients with difficulty breathing. The knee chest position is used for proctological, rectal, exams and sigmoidoscopy, providing optimal access to the rectum. Lithotomy is for vaginal exams, Fowler's for respiratory distress, and Trendelenburg for hypotension. Proper positioning improves visualization and patient comfort during specific procedures. Question 17. Which position should the patient be in for a vaginal exam? Prone. Lithotomy. Sims. Fowler's. The lithotomy position, on back with hips and knees flexed and thighs apart, is used for vaginal examinations, pap smears, and childbirth. Sims position is for rectal exams, Fowler's for respiratory distress, and prone for back examinations. Correct positioning ensures patient comfort and procedural success. The MA should help the patient into position while maintaining modesty. Question 18. The first thing a medical assistant should do when finding an unresponsive adult is: give 2 rescue breaths, then start chest compressions. Roll the person onto the left side, keeping neck and body aligned. Check for a carotid pulse on the side closest to you. Look into the mouth for an airway obstruction. The first step is to check for a carotid pulse for no more than 10 seconds. If no pulse and not breathing, activate EMS and begin CPR. Airway assessment and rescue breaths come after pulse check in the BLS algorithm. For healthcare providers, the sequence is pulse check, then CPR, compressions first. Scene safety must also be ensured. Question 19. When checking sterile supplies, the medical assistant should unwrap and re-sterilize packs older than 21 days. Examine sterile packs and discard any that are damaged. Arrange packs so that those expiring last are used first. Seal expired packs in plastic to extend use. Sterile packs must be inspected for damage before use. Any pack with tears, moisture, or compromised seals should be discarded because sterility cannot be guaranteed. The principle of /first in, first out / ensures older packs are used before newer ones. Damaged packs should never be used regardless of expiration date. Question 20. Sterile technique must be used when placing sutures in a new laceration, removing sutures from a healed laceration, performing a pap smear, performing a rectal exam for hemocult. Sterile technique is required for any procedure that enters sterile body sites or breaks the skin barrier, such as placing sutures. Removing sutures from a healed wound requires clean technique, not sterile. Pap smears and rectal exams use clean technique, enter naturally colonized cavities. Skin cleaning prior to sutures is an aseptic, clean procedure, not sterile.